Hi, and welcome to Mind Your Health. Dr. David Burke and I are here today, and we're going to have a lovely, wonderful show for you. And I have a feeling it's going to be, this is one I think you're going to want to really pay attention to because it's going to go in directions none of us predict. Is that great?
As usual.
As usual, exactly. I would like to introduce you to Dr. Matthew Epps, who is enjoying his coffee, I understand it. You said it was quite
It's
good.
wonderful.
And I actually have to say that you come very highly regarded. And so we are excited to chat with you. And you have so many areas of expertise that we're not really sure how we're going to guide this conversation, but we're going to just let it happen. So here we go.
Yeah.
We're not talking reconstruction. We're not talking fixing something that's broken and making it look normal.
Right.
We're taking something that is normal and making it better. That's why it's such a challenge. That's why it's all a specialty now. That's why you really have to look for that kind of education and knowledge.
Mind your health.
Got to mind your health.
Mind your health.
Treat yourself. You got to mind your health.
Let's talk a little bit, if you will, about you, Dr. Epps, and who you are. Talk to us about your training and children, all the good stuff.
I wish I could remember how I was when you saw us grow up.
Yeah. Well, and he went to school with my son, and there's a bunch of doctors out of this whole group of folks, which is pretty interesting.
There
You're
were,
a tennis guy.
there were all tennis. So one interesting thing I found out about tennis is if you as they go up in the tennis ranks, you go up to like level 3, 4, 5, and then I've never met anyone who wasn't brilliant who was a level 4 or 5. At least
Wow.
because of the mental game that it takes. I mean, it's a split-second reaction you have to something, but it changes every single time. And then it varies upon what surface you play on. So if you have grass, clay, hard court, you could have done any one of those on a Monday, Wednesday, Friday, and every angle and every bounce of that ball changes.
So is life a mental game for you?
That's the other thing. So tennis is one of the hardest mental games. You're on your own. As a surgeon, you're on your own, and you're out there and you're doing some things that are absolutely, I mean, I think some of the most complex things you can do in this world with surgery. It's not a robot really doing that for you, especially in my field in plastics.
Talk to us about your field, because you're more than just plastic surgery. Talk to us
Right.
about what that is.
So plastics has changed so dramatically in the last, I would say 7 years.
Okay.
But COVID really accelerated it. And what happened in plastics itself, what is the study of plastics? Greek word of molding plastic. And it came out of World War II. There were two surgeons in World War II that were taking care of pilots that would be burned in the cockpit. So they'd have burns on their face, and you have to have a nose reconstruction, ear reconstruction, eyelids, neck, throat, hands. And so that's where plastics really came out of. And then from then on up, into the 70s and into the 80s, it really is about reconstruction. And about the 80s, you started having that's when the corning implants came out, things like that. And all of a sudden people could have these enhancements to the bodies that were unnatural.
Unnatural
Or
enhancements.
Yeah. And
Now
so
we're talking.
then that came out, and then that was one of those things. Back then, plastics, again, was still really an institutionalized thing. There are things
Okay.
that date plastics. We can talk about that too. You can tell a practice is dated by the name of it, like how it's named.
Give me an example.
Enterprise, so and so enterprises,
Okay.
so and so institute.
Oh, that makes sense. Okay.
Not definitive, but that label is just late 90s,
Okay.
early late 90s. Hand fellowships,
Got
early
it.
late 90s. Like those were things that you did to help yourself, especially when we had recessions. Like, so you'd work. Plastics is entirely driven by the economy.
Wait, plastics is entirely
Yeah,
driven
it
by
is.
the economy.
So
Now or always?
I would say always. It always has been, because if it's elective, so it depends on if you're reconstructive or elective. And I should probably
Okay.
differentiate. My world is aesthetics. So everything I do is to make something better that already is good.
Okay.
So the other side of plastics, which is as far as the residency trained plastic surgeons, 90 some odd percent of what you do and what you learn to master is reconstructive. 20-30% of it's hand surgery. It's odd. So it's
Okay.
something that we're retaining. I don't know why. A lot of that goes into orthopedics now because that's what they do. It makes sense to me, but it was because of the fine work that's required that you would have a plastic surgeon as well. Then there are some wonderful hand surgeons that are plastic surgeons. I know them, but the field itself has really kind of drifted. And now it's like you go on, it's TikTok, YouTube, Facey Space, and all that. You're looking at facelifts, eyes, breast enhancement, BBLs, body surgery. So the field of plastics has changed so dramatically from just having reconstructive procedures. Let's reconstruct, like a leg that's been in a bad car wreck to cover bones or hardware, to let's enhance the V, the V of the bottom of your back, um, to make it
No,
look like
I've
you're
used a
more
W.
advanced, right?
I don't even hear
Um,
one.
so it's changed so dramatically that it comes to where it's no longer and just saying I'm a plastic surgeon or what we hear in Bluffton's always like, who do you go to for this? And all you see is so and so is the best, the best, the best, the best. And it's like, well, it's kind of like if you're gonna tow a boat, like, yeah, you can get a car. This car is the best, the best, the best. But you go, well, actually, maybe you want something with a V8 engine in it if you're going to pull out of a boat ramp. Maybe you want something four-wheel drive. Maybe you want a truck. Maybe the truck doesn't have a weight over the back tires to get up the ramp.
So if you're working on my face or
Yeah,
this area, I want somebody who
exactly. That's where I'm headed to
really,
it. So
yeah.
you kind of go down this road now. It's like, yeah, there's some shameless marketing everyone does. It happens, but you really have to start looking at that. There's these fractions, like fractionated field. So you have people who do breast and body work, and then you have
Okay.
people who do facial plastics. You have people who do it all. There's some crackerjack surgeons that can do everything.
Hmm.
But liposuction alone, over 30 minutes a day, starts to affect the carpal tunnel.
Okay.
So this is a study that came out a few years ago, white paper came out. And so if you're constantly doing liposuction, let's say you do breast and body work, and then you're going to go work on someone's eyelids and reconstruct their eyelid, your fine
Right.
sensation is a little bit diminished. And
Oh,
so if
interesting.
you're like
really?
me and you're like, I love the going into the fire. I love the hard stuff. That's
Right.
what I go to.
And I'm going to go back real quick. One of the
Yeah.
things you said was about a white paper. And when we talk here about Mind Your Health, about evidence-based stuff, white papers are when all kinds of data's been collected. And a white paper is kind of put together to say, okay, here's what we found. Is that a fair way
That's
of saying
exactly right. Well, so in plastics, we kind of have these kind of divisions now. And so you have multiple different boards that are deciding who can be a plastic surgeon. How do we train plastic surgeons? Um,
You're an
and
ocular?
I'm weird. I'm one
Well,
of 41 plastic surgeons in the United States who are oculoplastics trained.
right.
There will be no more. I was the last one. I was trained by a guy named Mark Cotton. I wrote the textbooks. Everyone learned under him. In fact, the ophthalmology oculoplastic surgeons use his textbooks too.
Cool.
And he unfortunately passed away during COVID when I was with it. So, but there are 41 of us. We're all over the country. Most of us run medical groups. Most of us are on leadership councils. We're in major cities. It's an extra level of understanding of things. But what it really teaches you when you go and specialize like that is when to operate and when not to operate.
Ah,
I can teach you to operate. I can teach a lot of people to put breast implants, and it's not that hard.
okay.
I can not really teach everyone instantly when not to do it, what technique to use, what plane to use, what kind of implants to use. And so that's the really hard part. And then the post-operative management, things like that. So when you do these fellowships, you just save about 5 to 10 years of learning on an unsuspecting society and figuring out what works. And so I did 3 of these. I actually did on paper 5 of them.
Okay.
So that's 2 residencies, general surgery, plastic surgery. I fellowed up in Long Island with Jim Romanelli's, who's a amazing surgeon up there, very prominent surgeon, and Alan Kisner. Alan Kisner studied under was another surgeon who's up there, very well-known South African surgeon who kind of took me under his wing too. This is like the PGY9, so my 9th year of training.
Oh my
It's like,
gosh.
I'm tired just
when I'm
hearing
I
it.
am too.
but these people they also learned from people who found out. So Alan Kisner himself he followed under a guy named Ian Jackson, and Mustardi. And so anytime that you're pinning years back, you're using the Stardy sutures. So that's how you fold the helix back. And so I learned from the guy who learned directly from the guy in Europe that created these procedures coming out of World War II.
And I'm going to interrupt you as you're telling us all of this
Yeah.
because it's sort of a so what? Okay.
Yep.
So what?
Well, that's where I was going to go because I
Is
think with
right.
with medicine, you see so many physicians that are under the gun with reimbursement and Medicare and the lack of funding, all that. So many people have branched off where you can't help. My dentist is doing dental cosmetic surgery. The estheticians, the
Oh,
dermatologists are doing, hey, we can do this with your face. All it seems like I think my chiropractor is, I think, it does some stuff too.
GLP-1s now.
Correct. I mean, it seems like everybody is
Like he's
trying to
getting
ride
fired
that
up.
gravy. Yeah, trying to
So this is
ride that
what
gravy
happened.
train.
So it all changed about 7 years ago. I
Okay.
would say that would probably be the nidus. Would probably be about 7 years ago. There were some things that came out then. We started to do deep plane facelifts. We started the implants changed. The whole idea of what body sculpting was changed in my field. Botox really became
Right.
prominent. Fillers
Fillers.
were now more natural. There was Juvederm really pioneered some of that, and now Restylane taken over. So when all these things, so you could choose which path you wanted to go to, and a majority of people did that. So in 2019, when I was fellowing, that was in New York City at the time. There were a handful of aesthetic fellowships in the country, and most of those were to get one of those, you have to not only get through into medical school, you then have to get into a top ranked residency, and then a top ranked plastics residency if you weren't an integrated resident, and then you had to somehow compete with all those people at Harvard, at
Yeah.
Yale, at UCLA, UT Southwestern to get one of these spots, and there's only one or two possibly at wherever you're going. And so at that time, you could kind of pick your poison. Where do I want to go with this? And most of them were just general plastics. They were going on doing aesthetics, but this was called aesthetic surgery. So now we're creating the same aesthetic surgery. There's Aesthetic Society of Plastics kind of became more prevalent, but at the exact same time as choose your poison, the field of facial plastic surgery and facial plastic surgeons, a whole nother ENT training. I ended up doing their fellowships, the last one I did, the whole thing, like, is just so I learned what they do too. But then you say you had these divisions that come out of it. Well, at that exact time, each one of them would have low-level providers that they would employ that would be doing your Botox and they were doing your fillers.
Oh, so
and
now I
doing your
got my
lasers
nurse, my
as you're picking which way you want to go. And so if you want to, sit and do mommy makeovers all day long, your esthetician down the hallway is your Botox and fillers are going to generating income off of that. So it's kind of like a dentist with that. The funny thing about dental practices is you never see what would happen if the hygienist could go on their own.
got it.
Instead, you have 10 rooms that they're all, like 10, it's like a sweatshop in there.
Right.
What would happen if the field of dentistry was ever affected? The little lobby groups are amazing. So I don't know. But what if the hygienist could just go down the street and I could just get our teeth cleaned for $50? Like, what would that, like it should be?
So that's what happened.
We're going somewhere with this.
Yeah.
So what happened was, and dentistry is always, it's one of the interesting things because your teeth are so important to your health and how that hasn't been integrated into somehow management, especially around here. Someone's paying $60,000 to have posts put in a day.
Exactly.
Like where's
I'm
doing
gonna-
this for $60,000 in a day?
I'm
It's
going to
like-
pull you like this because I want to go back
Yeah.
to how no, don't even, because there's so many things to talk about with this whole subject. But where you were going with this is now we've got our surgeons and we've got our mid-level providers.
Right.
Okay. And what happened?
Well, I also think, but outside of plastics, you see this in medicine. So you see more divisions, more specialty. Like
Right.
if you're in Atlanta and you have a spine problem, you go to a spine doctor.
Okay.
If you're in Bluffton, South Carolina, your orthopedist or your neurospine is probably doing more broad treatments.
Okay.
And I actually think those people are pretty brilliant. Like if you could still handle the whole like pattern
Spectrum.
of things in your field and you can do it really well, then that's pretty darn brilliant because you can get to where you're really isolated. Like I
Yeah.
know somebody up in Long Island that just does brachioplasties,
Oh, wow.
advertises in Korea, has it in his same practice. They fly in and all he does is just brachioplasties.
So what do we need to ask as consumers of our providers? Because I hear all the time, I can tell you 20 friends who go to different mid to level providers for this for face work. I don't even know how to
Stuff.
All right, first, it's understanding how that happened.
Okay.
So why do you have so many different
Okay. So
people?
you're laying a foundation for us
Yeah.
so that we can understand how this
So
happened.
COVID comes along.
Okay.
I had just moved out of COVID came. I had just moved out of New York City, December 27th, 2019.
Okay.
Where do we go? Atlanta, home of the CDC. So went to practice in Buckhead and with Dr. Codner, and there was a real medical shortage. So who treats people? You know, when you have a medical shortage, you have to grab from everywhere.
Right.
Mm-hmm.
So your politicians say, well, let's lower, and your lobby groups say, let's lower what's required to practice independently. There's a very well-known politician here who did that. So then you all of a sudden now you have lower level providers used to have supervision of some kind, whether it was justified or not, are now on their own.
Oh, this
Well,
is
guess what they do?
fascinating.
Well, they get tired of the reimbursements. You get nothing. Why do that? You
Yeah.
let out just, hey, let's go take a weekend course.
Mm.
Let's go do some esthetician work or
Mhm.
hire an esthetician. Let's get a laser. Let's get Botox. Let's get fillers. And let's start doing chemical peels. Let's start telling people they don't need surgery anymore because that's scary.
Right.
Because now we have all these factions, and so the next thing you know in society, especially in South Carolina, you have so many different people with such a broad range of education and understanding of things that are pretty darn complex,
Mm.
doing it with little oversight. And this is all over the country.
Right. This is not,
this
yeah,
is
and that's what we're
everywhere.
talking about. Right.
And with the with the way plastics and what I do is driven by economy. And so if the more of the gatekeeper of it would be a surgeon or a doctor, it's going to be more expensive because of the cost of overhead alone.
Okay.
And some of them dictate because they've been doing it for 20 years. Then you're going to go seek out what's less. Well, that's so much harder to do now because how can you gauge somebody's knowledge level? They're not going to tell you.
Well, yeah.
So I tell you, I just started this. I just got that laser last month. Let me
Right.
try it on you. I'll do a free treatment.
I'm new at
Yeah,
this.
I
I
know.
can't wait to use
Yeah.
my new
I know.
toy.
Yeah.
They're not going to tell you that. And then, and without a lot of oversight, then ethics is no longer an issue. Because as a plastic surgeon, I have to answer to a group. Like I have to. There's accountability. But when you have kind of these lower level boards managing it, they almost don't want to hear about it before.
Right.
And
I
then
can
when they
see that.
do, they're overwhelmed. They just there's not much that comes as a slap on the wrist.
Mhm.
And so that's what you're going through is how do I know? Like, well, it's really hard,
Okay.
but there are ways to, I'm headed somewhere with this. There are ways to pick that. And there are ways to make that smart. I know a lot of very, very, very good nurse practitioners, PAs,
Yeah.
estheticians in the area.
Mhm.
But, it's how do you find that? And what do you do?
I think that's the real.
But it's all dictated by industry, and that's what has done what it did. So during COVID, we let open the floodgates, and then industry said, I mean, you can see it. It said, so industry said the big companies that make billions of dollars a year off of filler, Botox, whatever, said, well, how can I how can I sell more widgets? How can I sell more CCs of
Oh,
filler?
I never thought about that.
Mm.
So
Get-
then
get
they have
people to do it.
very powerful lobby groups. And so then now you're, and especially a small state, like
Yeah.
so then now you have this floodgate opened. But then on the back end, the industry says, well, if I can just get X number more people this year to buy this product, it isn't driven by outcomes. It isn't driven by safety. It isn't driven by ethics. It isn't like, is it okay for that person to do that? No, it's driven by
Profit.
profit,
Yeah.
which is, in my opinion, one of the worst things you could do with someone's health.
Mhm.
I agree with that.
I agree with
Do you
that too.
find so when so the two of us are sitting here, do you sit down with somebody and say, I think I can fix that. I think they need, that nose is probably, something I could do those eyelids. Do you find yourself doing that?
I know people who do that, and I know surgeons who do that. I know surgeons here who do that.
I mean, you couldn't, I mean, I
Right.
get,
Well, you
no,
can't
don't give
help
me your
it.
business
That's
card,
right.
but
Well,
you just,
I think as you get through these things, and it's probably all of us do this at some point. You start to build a successful practice. You're trying to fit more people in a day.
Right.
their patience wears out. All you need to do is have one one low night of sleep where where you're kind of worn
Sure.
down. Because when you wear down, your social skills go with it. We all know this in training. We all know this. If you're up for 30 hours, you no longer really have a lot of social tact with patients.
Right.
And so a surgeon will just blurt something out, especially in plastics. And they'll be like, oh, I can fix that. Or no, this is what I think you need.
And you're like, well, I'm
This
not
is-
here for that part.
No, like, this is what I think you need. I think you need this. And the patient comes in and says, I'm worried about my eyelids. And you're like, well, I think you need a facelift. And it's
Right.
like, no, you just did some irreparable harm to that person.
Mhm.
You should, as a plastic surgeon, never say anything that
Ah.
somebody does not tell you is a problem.
I love
You just
that.
created a problem.
I
Oh,
love
that's
that.
interesting.
Well, they do that. And I don't know that people mean to do it. Sometimes it's personality, sometimes
Yeah.
it just comes through. But if you tell somebody something doesn't look right, you've just created the nidus for them to look in the mirror now. And then they become obsessed with it. And they get so upset about it. And then if you do surgery on it, especially like your nose, you mentioned your nose, that's your
Uh-huh.
personality. It's like a belly button.
Right.
Then if you change it, they don't feel like they're the same person ever again.
Then how do
That's interesting.
you, so a client comes in or a patient comes into you, and basically how do you guide them? Do you try to develop relationship? Do you try to just listen actively?
My consults are at least an hour.
Are they?
Yeah. I mean, you get me for an hour. Average fee for a plastic surgeon is $2,000 to $4,000 an hour.
Wow.
You get me for an hour. And we charge a nominal amount just so people don't cancel.
Okay.
People don't shop around. Like we charge a nominal amount. And it shouldn't be, there are people who charge an exorbitant amount for consults and it kind of locks you in. You're like stuck.
Let
I
me
don't
ask
think
you,
that's fair either.
let me ask you another question. So I'm 72, my kids are in their 50s and 30s. Are you seeing more men, more women? Is there a demographic?
I personally see more. I'm seeing more men. I personally do because I'm a specialist, and you have
Okay.
to. So I'm a facelift specialist.
Okay.
So I did 2 facelift fellowships. I did also the ENT one.
What's a facelift? Can I just even
Yeah,
ask the
it's-
dumbest question ever?
No, it's a really good question, and right now that's a huge debate in plastics. Like in the field, it's a huge debate. What is a facelift, and what does it mean? But back to what you said. So if you come in, so your original question was like, if I
Yeah.
come in and I'm like, what do I do? What do I
Right.
do? You have to listen to the patient. That takes
Okay.
about 20 minutes.
Okay.
And I can't really be your nurse doing that while you're out doing something else. Like you're multitasking. You have to listen to that patient.
Okay.
And there will be little cues of what they say. And you hand them a mirror, something like that, which everyone hates. But the first step to it is identifying, in my world, it's 3 things. I stop at 3. I make people mentally go through the exercise of what if there's something, and it's not something, if there's something I could fix, it's if there's something you would like to enhance or that you would like different. What is it? Number
Here,
1.
right here.
And they'll walk through them all. Yeah, they'll walk
Yeah.
through it all.
Oh,
And
they
they'll walk
really do.
number 1, and you can see their eyes.
Yeah.
And when you watch their eyes, see, you and I have something very common. My undergrad degree was in neuroscience.
Okay.
And I went to graduate
yes.
school for neuroscience too.
Okay.
So psychology is my
Love
root,
that,
and so
yeah.
is my wife Jane.
Okay.
And so plastics is psychology.
Mhm.
And so we'll sit there and I'll watch your eyes. I will listen to what you say. And then I will double back around to it. We'll do 2. What's the second thing? And they kind of, oh, this. And then I said, what's your third? And like, and I'm like, no, what is your third thing? And they'll point to something.
Yeah.
And the point is, we just did an exercise to identify, at least with 3 degrees of separation, that I'm going to hit something here when we start talking that will actually be beneficial to you.
Yeah, I love that. That's
Because
pretty cool.
one of those 3 things is going to be in your degrees of separation of I'm actually hitting this. And sometimes the first thing is the right thing. Sometimes it's the second. And that has to come down to that whole thing of when you specialize, you skip the line, you learn
Yeah.
things 10 to 15 years. You learn from somebody who's spent their whole career doing it. And you learn, well, maybe that number 1 thing isn't what you think it is.
Right.
It isn't surgery.
Oh.
Or maybe that number 1 thing is really risky.
So one of the things we like to do in Mind Your Health, not only treatment, but prevention. So I'm quickly approaching 65. Is the facelift and some of the stuff, is it because of the weight? Is it because of sun damage? Is it because of just our body's age?
Right.
Is it and what can I do? What should I have done when I was 30 that may or may not have prevented some of the stuff now that I'm 60?
And back to what is a facelift?
We'll get there. So
Okay.
okay, so one of the neat things that coming out of the whole visual revolution, which is like online social media, everything's at your fingertips. You can watch it all day long. In fact, it's too addictive. You can't get people off of these things. You
Right.
watch it, you just get torn into it. It's like getting stuck in a mirror. Is that this younger generation is extremely healthy. These kids coming out now are going to be, I mean, just if you listen to them, they're exercising, they're eating healthy.
I totally agree with
They
that.
go to college, you go to college. They don't go to college for the social experience.
I totally agree.
And they're coming out and they are getting on a retinol in the 20s. They're getting on a vitamin C in the 20s. They're getting on, that's a whole other topic. If you
Okay.
want to, I'll come in one day, bring through all the skincare
We just need
products
to
and go
have
through
him for
this.
a day. We'll just segment it.
And but they're doing all this and they're wearing sunscreen. And sunscreen, what do you think? Why do I not like? I got personally, like an average doctor. I just don't do what I tell everyone else to do.
Right.
It's because it's greasy. I don't like greasy
Yeah,
stuff on
ew.
my face.
Me too.
I don't like
Me
it.
Me
It
too.
feels
Right.
weird.
Yeah.
That's why I
And
have
you
a,
just-
I have a gel because I
Yeah.
don't like the greasing.
So
I got
then you go to bed at night and you're like,
Yeah.
oh, I didn't get it all off.
Right.
But there are now so many different types of sunscreens. As long as you have a mineral-based sunscreen, you can get a powder, you can get a clear powder, a matte powder, a foundation powder. You can get a soft lotion, thin lotion, thick lotion. You can get a lotion sunscreen. You can get all these things now that there really is no excuse.
We're going to do a whole thing on sunscreens.
Yeah.
I swear we are. But he's dying to know about his facelift
Okay,
at
so-
65.
I didn't say I needed one.
I
Here's
know
what we're starting to
him.
understand. If you're people who specialize in facelift, this is kind of like the way your brain works.
Right.
Its eyelids are the same way, but they tend to be more compartmentalized. But what causes someone to age prematurely is loss of elastin, loss of collagen, the skin thins. But there's all these compartments in your face, and there's multiple compartments everywhere. Well, they hold fat. They're like structure.
Okay.
There's compartments here.
Okay.
There's 3.
Okay.
And when you're doing cheek filler, that's where you should be putting your filler.
I've never done these.
No,
No,
me
you
neither.
haven't either.
No.
Cheek filler, that's one of the best things that's one of the most fun and rewarding things you can do is cheek filler.
Here's
It's
what I'm
like
learning
amazing.
about you. I cannot randomly say anything because you are good. You got story.
So what happens when you age? And men are different than women. In fact, women are different than women. But the
hear that.
average person ages, and those compartments, the structure of them starts to become lax. Gravity wins.
This
muscles-
fluffy.
That's it. The muscles of your face can no longer hold it up.
damn
They finally,
Yeah.
laxity, loss of collagen, elastin, damage from sun. And what we're learning is that the sun damage, we always think of like skin, right? We're like, oh, it causes, tumors, things
Right.
like that. But what we're learning is that sun actually goes through. It's just like wearing clothes. If you went out fishing, you're sitting on a white boat.
Yeah,
It's like this background here. You're
right.
getting the most maximum exposure you can possibly get to sunlight. And even if you're wearing clothes, how do you get burned? It goes through that. So why would the skin, which is this thin little layer,
Yeah.
it has some melanin in it for some people that would absorb light. Why doesn't it go to the deeper structures? When you start to do some of these really fancy facelifts, which are what we do now, it isn't just a facelift anymore. There are multiple different ways to do facelifts. Not one is perfect. The newest thing is a deep plane facelift. That's one where that's a huge controversy right now. Is a deep plane facelift better than a standard facelift?
What the hell is a deep plane
It's
face?
so Denise Richards had a facelift. It was a big deal. Came out about a month
She
ago.
didn't consult me.
Good. And she had this famous actress, and it was a real big thing because people try to hide this. It's like a social faux pas.
Right.
It's one of those things is getting facial surgery. Well, she came out and had a deep plane facelift, and it re-elevates the gliding plane of your face.
Who did this?
The surgeon out in Cal. I actually had to have dinner with them about 2 months ago.
Okay.
The
so she
surgeon
had
who
this
did
thing.
it.
Got it.
Yeah, and about 5 other of the top people in the
Okay.
world. And he's actually an absolutely wonderful guy. If you had him on the show, you would have the same reaction. He is an engineer and he can tell you about anything.
I love it. So fun. Yeah.
And so I had fun with it. But he comes out and does, Denise Richards does his facelift. And all of a sudden, social media went wild.
Okay.
Because it goes, oh my gosh, deep plane, non-deep plane. Well, that went into facial plastic surgeons, plastic surgeons. Because plastic surgeons traditionally always done standard facelifts. It was like a taboo to go do a deep plane. That means you're going to the deep layers where the nerves are to your facial muscles.
Oh,
Ooh, time out. That's not good. But the facial plastics guys over the last 5 to 7 years kind of took it and ran with it. And so those are the people that are at this moment in time charging $200,000-$300,000 a facelift
I don't
to
even.
get
I
these
don't either.
results. So
I don't
this,
even
you
wanna
can see the
split one.
controversy.
Did
Right.
but
Yeah.
did she look like fabulous? Did she look like a
Yes,
17-year-old
looks
girl
fa-
now?
She looked no, but that isn't the goal. So we'll get to something. No,
If I'm paying $300,000, I'm going to look
but
like a
did she
teenage
look?
girl.
Did she look refreshed? The beautiful. I know.
You want you?
I know. I could get a loan.
Yeah.
I got 4 kids. It's probably not going to be able to do that with one of those guys. But, anyways, so that created this huge controversy at the time. Well, I do deep plane facelifts. I learned to do it. I fellowship trained to do it. I learned for 2 different surgeons. One who founded the field of facial plastic surgeons, Galen McCullough. He is actually one of the guys who founded the whole field of it for the ENT facial plastics residency. And then there's the plastic surgeons, traditional residency trained plastic surgeons, who had for the long time just done where you fold the deep layers, or you might get into it and slightly move it. Well, then comes Chris Jenner, who has this result that apparently in social media goes berserk because of an article written in Allure magazine. It said, "I'm not happy. My face is sagging." I met that surgeon in November, and he's younger, a little bit younger than me, but I know exactly what he does because I learned that technique too. It's called mastectomy, taught by Daniel Baker, who this guy used to work for.
Can we just
So
have a mini one?
yeah, so minis. So I learned minis from Alan Kisner in New York City, which was we would do 2 or 3 a day, and you would just. They're very nice procedures, but there are limitations to that. And in our
Okay.
population of Bluffton, that limitation is present.
And,
Yeah.
I think we've got so many topics and so many things that we're really interested in. We've only got a couple of minutes left. And I think if we've done nothing else today, Dr. David Burke, with you, Matt, I think it is to tease the public that there's a lot more to this topic.
Yeah.
I mean, honestly, because I came in thinking, oh, we're going to talk about fillers. Oh, let's talk about poofy lips or what a facelift is. And I think, like anything else, that's what makes Mind Your Health so powerful, is this is complex. This is not just how you look. Okay, this is about your whole being.
It is.
And I feel really privileged that you came today, and hope that you will join us again. Um, I think you've got a lot to talk about. You really do.
Yeah, and I like the mirror thing. Starting there, what is it that you hope to accomplish? What are you looking to do? And I like the psychology about it too. Is what do you hope this cosmetic or physical thing is going to do to your emotional, mental state? Is this going to make you feel more confident? Is this going to make you feel more
The
beautiful?
whole
Is this,
point of
right?
cosmetic plastics.
Yeah.
We're not talking reconstruction. We're not talking fixing something that's broken and making it look normal.
Right.
We're taking something that is normal and making it better. That's why it's such a challenge. That's why it's all a specialty now. That's why you really have to look for that kind of education and knowledge, because all it is about is making you feel better. It isn't about making your neighbor feel better because you look better, or your husband, or if like or your wife feel better because your neck now doesn't have tourniquet.
Right.
That's the whole point of this, is do no harm.
Ah.
And
I like
that has gotten
love that.
lost now because of you have so many people doing it that you can't, even with Botox, you can hurt somebody. That's how it wears off. But if you inject it under the lid, you start to weaken the membrane that holds the fat back, and also have premature aging. Now they have created a surgical problem using a Botox. It's really not so I think, and I'm a 3rd generation physician, I grew up with this. I think that the number one thing that you can do for somebody is just listen to them and steer them away from the things that would hurt them.
And on that note,
Yeah.
I think I'm going to say thank you. Thank all of you for joining us here today on our show,
Mind Your Health.